Hi, I'm Dr. Greg Castello, board-certified family practice with CastelloWellness.com, located in Lombard and Joliet, Illinois. And today I want to introduce to you a pretty amazing non-surgical treatment for osteoarthritis knee pain. It involves gel injections done right in the office using X-ray guidance to locate the gel correctly. It is instantaneous and long-term pain relief and can actually either delay or prevent the need for knee replacement surgery. So if you've been told that you need knee replacement surgery, this is potentially a good non-surgical alternative for you. Let's go ahead and show you what a normal knee looks like on X-ray. So here's a front view of a relatively normal knee, fairly smooth femur. The tibia is fairly smooth. You can see a good amount of space between the two bones, so the meniscus and cartilage are separating the bones and they're not rubbing together. Here is moderate arthritis, and you can see it's much rougher on the femur. This is osteophytes or spurs. Here's some spurs here. It gets very narrow towards the inside of the joint, and most arthritis causes that narrowing on the inside of the joint. Here is severe arthritis, and it is very rough and fuzzy. This is all new bone growing. All this is new bone growing. This is what we would refer to as bone-on-bone arthritis, where the bones are literally grinding together. So that's very painful knee arthritis. So the actual procedure is quite simple. The patient sits comfortably on the table. We use the X-ray equipment, which is live video, and first I find where I need to be to make my injection, and I make a little mark, and I can see that on the X-ray where I'm going. We clean the area quickly with alcohol. I actually put a little bit of spray of cold on the knee to kind of numb it up. We put a little pinch of numbing medicine in to the knee. I watch the X-ray and see where the needle is going into the right position. We place a little bit of dye in the knee, and that shows me that the liquid is flowing into the actual knee space where we want it to be, and that's an important part to confirm that we're in the actual knee joint. From there, we put the actual injection of the medicine in, and it's a very thick gel that we inject right into the knee. All of this is done with just one needle, one poke of the needle, and these syringes are changed out so you have that initial pinch of the skin, and that's really all that you feel. So here's the images we just obtained. This is a side view of the knee. So here's the kneecap in the front, the femur, the tibia, and here's the needle coming in right below the kneecap pointing at the femur. We want to avoid putting the needle or injection into the actual joint space because that will damage the meniscus and the tissue between the knee. You can see in the second picture here, the injection is flowing in between the joint and around the femur, so that confirms good placement of the needle, and the gel is going in the joint space exactly where we want it. Before picture with just the needle. After the injection, you can see the material flowing in between the knee joint. Thank you for watching. I hope that was informative. If you have interest in the procedure, I encourage you to call the office at 630-620-9500, and we can set up a free consultation and x-rays at either our Lombard or Joliet office. The procedure is covered by Medicare and most commercial insurances, so I encourage you to call today. Thank you.